Hello and welcome. I am Dr. Ankit Parakh and I work as a consultant in pediatric pulmonology and sleep medicine at Children's Chest Clinic, New Delhi and BLK Max Hospital, Pusa Road, New Delhi. So, does your child snore? Do you actually need to worry if your child is snoring? Do you know why snoring happens? So, in this video, we'll try and understand why snoring happens in children. What are the causes which lead to snoring in children? When do you actually need to worry? So what are the signs which tells you that this snoring might be a sign of an underlying serious problem? And what do you need to do about it? So snoring is basically a harsh sound which is produced when the child is breathing in and breathing out while sleeping. Now the snoring happens because the space in our airways become a bit narrow. Now usually we have enough space behind our nasopharynx, nose and tongue, and we can breathe easily in and out. Now when this space becomes narrow, it becomes difficult for the child to breathe in and breathe out. And at this situation, the upper part of the jaw, which is also known as the soft palate, that vibrates and that leads to a snoring sound. Now, what are the reasons why children start snoring? The most common cause is enlarged tonsils and adenoids. So most children who snore have large adenoids and tonsils which are leading to a snore. The other common cause of snoring which is now seen in children is excess weight or obesity. Children who are obese, they have a lot of deposition of fat around the neck and they have also a lot of fat deposition around their chest, which leads to problems and increased snoring. Now in addition, children who are obese, they get a lot of metabolic changes, hormonal changes, which also can lead to sleep apnea and snoring. Now, in addition to this, there would be children, especially who have some sort of genetic syndromes, who can have a small upper jaw. So this is known as the maxilla. So if the maxilla is small or there's a mid-face hypoplasia, a lot of children tend to snore because the airway tends to get narrow. In some children, the lower jaw or the mandible is smaller in size and it is a bit backwards, which is known as retrognathia. There could be some children who have some genetic syndromes where retrognathia can happen. Some children tend to have a large tongue, which tends to fall back when the child sleeps. Now, in addition, there could be children who have weakness of their muscles or hypotonia. And this hypotonia, increases when the child sleeps. This is more common in children who have Down syndrome. Now, a lot of children who snore, they can have multiple causes of snoring and not just one. So if my child snores, when do I need to worry? Well, 10% of children snore. And most children would snore occasionally with viral infections. That is not a cause of worry. But if children snore on a daily basis and the snoring is loud, then it can be a cause of worry because out of these 10% children who snore, 20 to 25% of these children could have an underlying problem known as obstructive sleep apnea. Well, what are the signs and symptoms which tells us that the child might be having snoring associated with sleep apnea? So children who snore on a regular basis but have additional symptoms like snorting, so something like this. Children who gasp while breathing. There could be situations when parents say that they find their child stops breathing for a while. These are known as apneas. Children who sleep in abnormal postures, like in hyperextended postures, children who always sleep on their tummy, children who pass urine in the bed. Now, these are some features of sleep apnea associated snoring. Now, many children who have sleep apnea associated snoring get symptoms in the day as well. Older children can become excessively sleepy. Their school performance can go down. There can be problems with learning and memory. Younger children tend to become more impulsive and hyperactive. Their concentration goes down, they become more irritable and frustrated. So, if your child has any signs which are suggestive of sleep apnea associated snoring or any daytime manifestation of sleep apnea, as we have talked about, you do need to get in touch with a pediatric sleep specialist. Now, in these situations, sleep apnea needs to be confirmed. The best investigation to look at sleep apnea is to do a proper in-lab sleep study. This is also known as a polysomnography. This should be done in a proper way, in a child-friendly sleep lab to get the best results. So if your child is snoring on a regular basis and is having any features which are suggestive of sleep apnea associated snoring or any daytime symptoms of sleep apnea, you do need to get in touch with a pediatric sleep specialist to understand what further needs to be done and possibly a sleep study as well. So thank you very much.